These are things that are great for everybody. Walking. Walking is wonderful. Plus it fills our lungs with air. It helps us to think about things that have happened throughout the day, and it's just very relaxing. And you know, there are so many dancing classes out there right now. I have seen so many people enjoy themselves much more dancing and building bone. I mean, how can you not have fun dancing and doing a little jig, you know? And then the one other thing that I add on here, because you may want to move up into these ranges, but you're at this range, right? And you don't have enough bone, and you're worried about your balance, and you don't think you can jump and hold yourself on your toes. This is where we use ball exercises. And we just have people sit on the ball, right? And some people honestly can't even sit on a ball, and that's okay. So you start with 2 chairs next to you, and you sit on that ball. And then you try to take one hand off. Then you try to take the other hand off, and then you move to what we call the hula. Wiggle those hips, okay? And then that's where you build up to going into these. Now, with the osteoporosis, what is recommended is to avoid any flexing, any bending or twisting of the spine. And the reason why they say that is because typically when you're calcium depleted and we have osteoporosis going on, it's also affecting your nerves and your muscles. So twisting stress is one of the hardest on the bones. That's not a strength that the bone learns. The bone learns up and down, okay? So that is why it's important not to add twisting if you already have osteoporosis. The most common hip fall is somebody is falling this way and their hip is turning and they're breaking the femoral neck right here. And that's the weakest area that we see on the DEXA scans, next to the lumbar spine.
The twisting also adds to degenerative disease from the discs. The discs just hate this pressure this way and going back and forth. It can literally grind them to bits. So, not a good thing. In an unweighed position, if you ever want to stretch, so in other words, you're laying on your back, then you can twist back and forth because there's no weight on the spine that way. Okay. Does that make sense? So, well, yeah.
Too much fun. So now we're going to work our way from what we learned back when all of this started of why do we have bone loss. So the exercise was the first thing. We knew that compression forces needed to happen. Then we started to learn about, okay, so how do the bones work? What happens in there? There are osteoclasts, which are our bone breakers. Be like Miss Pac-Man. Thank you, Tina, for putting that on there. These are like Miss or Mr. Pac-Mans, if you're female or male, because men do lose bone. Osteoclasts are what are made when we have low calcium in our bloodstream. So when there is low calcium in the bloodstream, the parathyroid hormone says, hello, we need more calcium to support blood clotting, nerve function, and muscle contractions. So let's get that calcium out of that bone. This is our reserves that we need to take out and help to balance out the rest of the body. So bone is one of the things that the body uses to store. Like fat, we store other energy molecules. Bone is what we use to store a lot of calcium. So when this calcium is stored and we eat, say, a low calcium depleted diet, or we're not having enough vitamin D in our system, which helps to regulate the calcium, then the body is constantly pulling out of the bone. The more sugar we eat, the more calcium we're pulling out of the bone. So does everybody see why we're going to see more osteoporosis earlier in the next generation, which is very scary? Okay. I noticed that my age group here is primarily perimenopause, menopausal. Few exceptions. We don't have any adolescents, no teens. Minus you. Yes, I'm sorry. A little bit of testosterone in there, right? Thank you for coming, gentlemen. We appreciate this because you do have these issues. You just don't have that menopausal hormonal flux, which tends to be where women lose most of their bones because of the loss of estrogen. Osteoblasts are your bone makers. These are like your masonaries. They lay down all that good building block, right? So those osteoblasts, this comes from when you have thyroid hormones saying, okay, we have plenty of calcium in the blood. Let's store the bone, store the bone. So that's where we go, calcium builds the bone. Calcium's gonna build that bone. So now these tensile and compression forces, compression, up and down. Tensile is like an elastic where we have collagen fibers in the bone as well that help to stretch. So, you know, if I pull on your leg, you're stretching the bone. Little known facts about calcium. Does everybody know that 30 to 80% of the population is deficient of calcium?
How can that be with everybody drinking milk?
Yeah, really.
I'll get to that.
Okay.
One moment, that's in my next slide. Things that calcium is used for is bone clotting, muscle contraction, nerve impulses, and bone formation being the last thing. All of these others have to come first, right? If you cut yourself, we want clotting to happen, and we want it to happen fast. If not, we're losing all of this good nutrients that we've tried to keep in our body, right? So, with this calcium being depleted in the body, how does that happen? Foods that we have them in.
Going too fast. Can't write that.
Oh, I'm sorry. There you go. I'll let you go. So I'll talk a little bit before I get to the next slide. So foods that we have that have a lot of calcium in them, everybody heard of the big dairy, right? That's the only way that we tout our dairy. That's the one thing that the Dairy Association has. We've got to push that milk has calcium. Milk does have calcium. It does. It is very hard to absorb in our body. We have a hard time digesting these things and breaking them down. Animal sources of calcium are harder for our body to break down than plant sources. So, natural to nature. The coolest thing that's out there, did anybody know that sesame seeds have more calcium in them than milk? Besides my lifestyle therapist, Tina, back here. How many people have ever used sesame seeds in a meal? Awesome. Do we use them often? Once a week? Once a month? Women? Men? We should have these daily. Awesome. Good job. Yes. Sesame seeds are very important. They contain about 35% of your daily nutrient intake that you need of calcium. 35%. That's great.
How much?
That is, tablespoon. Sorry. I didn't put it up there. I'm very sorry. But these are all easy and to digest and utilize. And have you noticed that anything that's on the bottom here, are these all things that we should be eating every day? And in large quantities of these three, okay? Large quantities of the vegetables. Very important. Oh, sorry. I switched for you. I should have checked in with you to see your pen stop moving. So why is calcium so important? It builds bone, yes. Now, calcium, one of the things that is easy to think about on how calcium works in the bone is, has anybody built a sidewalk, you know, with the pavers and things where you have to go in and you have to dig out the area of your sidewalk, right? And then you have to go in and you have to lay this fine gravel down. Level that off. Dig out the side for the pavers, put those in there, tap them down. Then you put some more fine gravel in and you use this machine that pats it down really hard. And that patting it down really hard, that machine is calcium, okay? Patting down our pavers. Then we put another fine layer down, and then you can put your little stone pavers down, and then you can walk on it. That's how calcium builds bones. It's the same way. Ready? Vitamin D, my favorite. Who does not love vitamin D? We have none right now. We miss the sunshine. Vitamin D is also deficient in 30 to 80% of the population. This has been, unfortunately, until a couple years ago, we didn't know enough about vitamin D and how it worked and what it controlled. It is more like a hormone than a vitamin. It regulates a lot of our hormone functions. If vitamin D is present in the intestinal tract, it will tell the body, and there's calcium present as well, it will tell the body, okay, we have plenty of calcium here, let's build bone. So on average, 90% of the patients that get tested for vitamin D come back deficient. And deficient in most eyes is under 50. And in the Dr. Hollick's article, which Dr. Hollick has been, would you say, the founder of vitamin D?
In North America, for sure.
Forefather of vitamin D here. He says anything below 35.